Shabab. Welcome to the third session. The title is Physiological Changes During Pregnancy. Okay. May I request you to switch off the phones? May I request you to switch off the phones and keep it in the pockets? Okay. So far we have covered the issue of the menstrual cycle, how ovaries produce ova, how ovulation happens, what is the physiological process of menstruation, and after ovulation the next important topic is pregnancy, which is coming up. We have missed one lecture which we will arrange this week, if you remember. Okay, it is about the puberty. That's not an important issue to do before pregnancy. We can do it after pregnancy also. Okay, physiological changes during pregnancy. So let us first of all brainstorm about the terms. How much do you know about some of the terms? Have you covered the lecture of irregular menstrual cycle also? Yes. Good. Did you get the answers for the terms? Yes. Okay. All right. We'll have a discussion again, okay, in some form or the other. We are having a tutorial also, which is coming. Okay. Pregnancy. How do you take it in the terms of definition? Okay, if you want to define pregnancy or understand pregnancy in a form of a sentence, how do you do that? What do you think? Well, we all know the meaning of pregnancy, no doubt about it. Okay? But how do you express it? How do you say what is pregnancy? It is the stage. Okay, it's the stage. What stage? Again, it's not clear.
Developing a new human.
Okay, a stage in which a new human being is being developed. Okay. Fertilization. Okay, we are just gathering the words, all right. Okay, we are just using the building blocks and then we'll make a definition. Yeah. Okay, so you are saying fertilized ovum and implantation. See, the terms are coming: fertilization, implantation, development. Okay, stages are coming. Yes, my dear. Okay, and it follows the stoppage of the menstrual cycle. This is one of the features of the pregnancy also. Okay. All right. So we do agree that all these terms are used when we are describing the pregnancy. We talk about fertilization, we talk about implantation, we talk about the development of the embryo and the fetus as a human being, a new human being. Okay? That's true. So let us take pregnancy as a period. Is it a period, a time period? We know that, okay, during which something is happening. Okay. Fertilization is the starting point we can take. Next process which is coming on, which is very important, is implantation. Okay. And then we have the phase of development which goes on. Okay. And then it culminates or finishes at the time of delivery of the baby. Okay. So it's a period or a time period or a duration during which an offspring or a baby develops inside the mother. Do we agree with that? Okay, all right. Now, we need to know the alternate names of the pregnancy. What else can we use for the pregnancy? Let us first consider all those terms. So we have considered the term of fertilization, and I hope all of us know the meaning of the word fertilization. All right? We are also using the word implantation, and I believe all of you also know the meaning of implantation. Okay? If we are using some other words, if I give you another word and I say there is a word known as conception. Okay? Conception. We use the word conception also. We'll come down to the meaning of this word. Okay? And the next word is gestation. Gestation. Have you ever heard of this word? Gestation, or the period of gestation, or the age of gestation, like this. Okay? We also use this word. Okay. And maybe in Gynae and Obs lecture, you might have come across a word gravida. Have you? Okay. So I'm using a word gravidity also. Okay. So now we have a choice of words from fertilization to gravidity. Okay. And one word is parity also, I believe you have heard about. Okay. Para or parity. These are the terms that I think you have stretched and used during the lecture. How much is your understanding? Let us see. Okay. So I want the synonyms or the alternate words for the pregnancy. So which words would you like to choose for the pregnancy? An alternate. Gestation is a good choice. Okay. All right. What is the another thing? Gravidity, a state. See, gestation means a period or a phase during which the baby is developing. So it's good. You're saying gravidity. Okay? Gravidity is another word. If you're saying that, what is the meaning of the word gravida?
Being or being something.
Being pregnant again. Okay? When the female is in a state of pregnancy, when she is bearing a child inside who is developing, this state is called gravidity. And she is a gravida. Okay, as long as the baby is inside, whatever the stage of baby is, if the baby is there, if the developing human is inside, you call it gravida. Okay, so can we use gravidity as an alternate to pregnancy? All right, okay. So we are choosing these two words. What about conception? What do you say about conception? Fertilization. So let us take it as an alternate to the fertilization. Conception means when you are fusing a sperm biologically with an ovum in order to produce a process called fertilization, and then it carries on. Fertilization may be an event or a starting point of the pregnancy. All right, okay. According to one belief, and the most common belief, fertilization is the starting line of the pregnancy. Yet others believe that some days after fertilization there is a definite process, there is another process which marks or which is the hallmark of the pregnancy, and that process is implantation. Okay, when in true sense the developing fertilized ovum, which is dividing into cells, is now attached properly and it is giving a status of a true pregnancy. Okay, so there are different time periods or different definitions that we can use. All right, what is the total duration of pregnancy and average pregnancy in terms of the weeks? 40, 40 you are saying. Okay, so if you multiply 40 by 7, how many days do you get approximately? 280. Okay, so it could be 280 plus minus, maybe sometimes a little days more or a little days less, it depends. It is not fixed or endorsed that every time 280 days and there is a delivery of the baby, early or a little late. Okay, so the total duration of the term, total term means pregnancy here. Okay, we are using the word term. I'm talking about the timeline of the pregnancy, the total timeline, right from the beginning to the delivery of the baby, timeline. You are saying 40 weeks. Do you agree? Okay. Let us take it as 40 weeks. It's okay. 40 weeks. Now I'm using few terms, and let us discuss those terms one by one. Okay? The first term is preterm. A baby is born, we say, oh, it's a preterm baby. I'm sure you have done it before also. You have heard the word preterm. Okay? Now, what do you exactly mean by that word, preterm? Before the time, right? Before the proper time. Then what is the proper time?
Sometimes you can say it's a preterm. It's below 37 or equal to 37 degrees.
Okay. Abdullah is saying you are choosing the 37th week as the dividing line. Before 37 weeks, if the baby is born, the baby may be okay, no problem. But the baby will be known as preterm. Do you agree with this explanation? Yes. 37 weeks? Yes, Abdullah, thank you. Okay, this is the right answer. So before 37 weeks, you will call it preterm. Okay? I may use another word and I say, oh, the baby is an early term baby. Early term baby. Okay? What do I mean by that? I'm not saying preterm now. I'm saying early term baby. Before 40 and after 37. Amir is now saying that from 38 weeks to 40 weeks. So before 37 is preterm. Now you are starting from 37, okay, because 37 is included now. Okay, Qabl was preterm, all right. So 37 weeks and 38th week also. If you take, if the baby is born between these 2 weeks, 37th week or 38th week, 37 and 38, these 2 weeks are used for the early term. Okay, now it's the term time. It's the term time, but it's an early term time. Okay, so you call it early term. Okay, then there is a next term which is a very fair term. We call it full term. Full term baby. 39 and 40 sequentially you go. Okay, thank you, Mothers. Right, it's 39 and 40. Okay, before 37 it was preterm. 37 and 38 you are considering as early term. You are now in 39 and 40. 39, 40 is good, very good time really, okay, perfect time. So you call it full term. Then I say late term. Just like early, you also have a term late term. Yeah, if the baby is born in 41st week, then it's slightly late. So you call it late term. Still normal, nothing wrong with the baby, but sometimes it happens. Okay, after completing 40 weeks, the baby, now the pregnancy goes into 41st week, and sometime during that the baby is born. So you call it the late term. Okay, and finally we use a term which is known as post-mature baby. Post-mature. What do you think about this one?
It's after 42 weeks.
Yeah, from 42 weeks, anytime in the 42 weeks and onwards, if the baby is going 42nd week, 43rd week, 44th week, it depends really. Okay, sometimes babies are carried for a longer time because of some abnormality. This is not good thing. Okay, this is not a perfect time to be born because there are some complications for the baby and for the mother also. It's okay, but so this is called the post maturity. So you are using the term preterm, all right, and you're using early term, you are using full term, you are using late term, and you are using the term post mature. In this way you are using descriptions for different times of delivery. Okay, so keep it in mind, you will come across all these terms. It's a full term baby, it's an early term baby, it's a preterm baby, it's a post term baby or a post mature baby, like this. Okay, so you will use all these terms. Are we all clear about the terms, the description? Okay. All right. Now, significance. Pregnancy is a very, very special phase of life. It's pure physiology. It's a pure adaptation. It's a perfect match. It's a perfect adjustment of the maternal body. Mother is doing everything. Mother physiology is changing. Why it is changing? Because a new life is being processed inside. A baby and human being is developed inside. And for that, mother has to make adjustments. Okay? Mother is making adjustments in her body. Physically, anatomically, physically, functionally, biochemically, and psychologically. All sorts of adjustments are being made inside the maternal body. Why? Just in order to accommodate the baby and to keep the fetal well-being or the fetal growth. Fetus has to grow perfectly inside. It's a long journey. It will take 9 months really. So it has a lot of preparation, okay? Lot of work to do. So that mother is well and the baby is well, both has to carry along. Both will have to carry, okay? Well, the changes will happen in many areas of the body. All the systems will change anatomically and physiologically. There are many changes coming, and one by one we'll start the changes. Let us begin with the female genital tract, or the genital tract of the mother when the baby is developing inside. Well, in the genital tract you have different parts, obviously. We can very well imagine that the size will change, the size will grow, okay? The womb of the mother, or the area which develops the baby, is uterus. You all know that, okay? So first of all, let us consider the uterus. What is going to happen inside the uterus? Size will increase definitely, okay? Do you think it will undergo hypertrophy? Yes or no? Yes. I'm talking about smooth muscles, overall size of the uterus. Yes or no? Okay. Do you think it will undergo hyperplasia? Multiplication of the muscles also, increase in number. So do you think both processes will happen, hyperplasia and hypertrophy? Initially, in the first half of the pregnancy, there is hyperplasia along with the hypertrophy. And then later, there is further stretching and increase in length. You are more towards hypertrophy than hyperplasia. Okay? So the size overall increases. And uterus, from a little organ of this size really, this is the size of the uterus, normal uterus in the female. That is it. Now imagine, if this is the size of the uterus, this much, okay, few inches by few inches. Now this uterus turns into a big bag or a sac, a very strong muscular sac, okay. This pear-shaped structure changes to a kind of a spherical or a globular structure, and that carries the baby. You can see the size of the uterus inside if you cut it, and if you see, that is the size of the, and it is this much really, okay. This is the size normally in a nulliparous woman, okay, or in a non-pregnant woman. So uterus, definitely the weight will change from like 50 grams. Imagine what is 50 grams wazn, okay? And that changes to 20 times or more than 20 times, and it becomes 1 kg or more than a kg, sometimes 1100 or more. It depends really, but at least 1020 times increase in the size, weight, okay? From a little structure pyriform, it becomes like kind of a globular or spherical structure, and total, imagine 35 centimeters, okay? From this 7.5 centimeters, 3 inches, okay, it goes to the 35 centimeters, 7 times more. All right, so uterus has to adapt definitely. It is the place where fetus is growing, okay. During the pregnancy, there are some contractions. You know, contractions will happen properly when there is a time to deliver the baby. That will come later in the 9th month sometime when the proper contractions start. But these false contractions called the Braxton-Hicks contractions. These contractions, they also occur time to time in the pregnancy due to some stimulation by the hormone or response of the muscles, but they are insignificant, they are purposeless, they will not do any harm, they will not cause any stimulation of the uterus, they will not do anything wrong with the baby. Okay? So these irregular contractions, very short duration, few seconds only, maybe less than 30 seconds or so, and very irregular, appearing one day, 1 or 2 times, then for some days they will not appear at all, then another day they will appear like this, and they are not causing any discomfort or the pain also. Okay? These contractions are Braxton-Hicks contractions. Okay? So in the uterus, few things are happening. Cervix and vagina, definitely. Okay? The cervix is growing. Okay, as the uterus is growing, the lower part of the uterus is the cervix, which is growing, which is closed. The os is closed totally, and there is increased vascularity and congestion of the cervix. The vulva also, from the outside, okay, external genitalia, that becomes congested and edematous because of the fluid, because of the vascularity, because of the increase in the tissue size. Overall, the vulva, actually the whole tract is preparing slowly because the baby has to come out really. So all the preparations are being done in anticipation. This is important. Okay? And that sign of congestion and vascularity is called the Chadwick sign for the vulva. All right. The secretions of the vagina, they also increase, and there is kind of a whitish secretion coming from the vagina, and these whitish secretions will give the term leukorrhea, flow of some secretions, and leuco means white in color, as you know. Okay? So highly acidic and effective secretions, and these secretions are good, again protection, so that the bacterial growth is avoided. Even though there are chances of bacterial growth during pregnancy, the immune system goes down slightly. But at the same time, there are some protective measures being done, and one of these is like secretions. Okay? The changes in the ovaries will also come, definitely, and the size will increase. And you know that corpus luteum, after some time, the last corpus luteum which happened in the last menstrual period, that will slowly regress in size and disappears after about like 10 weeks or so. It's gone. Okay? Because now placenta will take over the whole responsibility, and that will continue. There is no need for corpus luteum. Initially, yes, for 2.5 months, 2 to 2.5 months, pregnancy is supported by the corpus luteum. The hormones are coming. But later, when you have given time for the placenta to develop and function completely, it's good. Placenta will take over the job and everything is perfect. Okay. The changes in the breast, the maternal breasts are very special in the sense that they are preparing themselves right from the beginning. Okay? The breasts will increase in the size, definitely, and their skin, the areola, nipple, everything is changing. Okay? It's a phase of preparation. The breast size will increase, definitely. There is engorgement of the breast, the vascularity increases, the soft tissue increases, the fat deposition increases. All the hormones are acting on the breast. The new hormones coming from placenta, they are targeting the breast, and they are causing the development, further development of the breast. The size of the breast becomes increased and heavy, and you can see in pregnancy there are some special, it's not very clear here, but if you see, this is the area of the nipple and areola, and around that, when you see it, the presentation yourself in your laptop or the computer, you'll find out that small tubercles are there, and these small tubercles are developed dilatations or swellings, and these tubercles are the dilated sebaceous glands or the lactiferous ducts. These dilated structures are called Montgomery's tubercles. Okay? Montgomery's tubercles are the sign, one of the evidences of the pregnancy, because lactiferous ducts inside, they are getting developed and dilated. These are the sebaceous glands actually which become dilated. Okay? So these tubercles are being developed. Inside, the alveoli are developing, the duct systems are becoming prominent, the fat deposition is there, overall size So there is hypertrophy and hyperplasia along with the fat deposition, and the vascularity is also increased. Okay? From the middle of the pregnancy, mid-time of the pregnancy, some milk formation also starts in the breast, okay, from the middle of the pregnancy. Maybe after 20 weeks, between 20 and 25 weeks, if the woman compresses the breast like this, a little milk can be elaborated, it can be expressed, okay. Well, this is surprising. The baby's time is 40 weeks, and from the middle, after the middle of the pregnancy, the milk apparatus is functional, not very much, but it has started. Why? Yeah, but what is the significance of that? Yes, underlying hormones which are doing it, it's done by the hormones. Estrogen, progesterone are developing, and then prolactin is coming and prolactin is helping. You're right. But my question is, why so early? Oh yes, so Sam, thank you very much, because you never know. Babies are born after 28 weeks, 29 weeks, 30 weeks, okay? So Allah subhanahu wa ta'ala has made a system that even for the early baby, okay, the breast doesn't have to wait for 5 or 6 weeks more after the birth of the baby. The moment baby is born, the breasts are about to get functional anytime really. So that's why it's a safety margin to be early, as early as possible. Don't wait for the 40th week or the 30 weeks or 35 weeks or so, isn't it? Okay, so that's all logic really. At the time of the birth, a little before birth, a very thick yellowish milk is elaborated from the breast. The first milk which is coming, this is called colostrum. Okay, colostrum. Colostrum will be secreted as the baby is born. Okay, and the mother starts feeding the baby. The first feed is not the milk actually. It is very thick jelly-like thing, yellowish jelly. Okay, which is a condensed milk form really. Okay, and that is very, very nutritious, full of antibodies, full of proteins, very thick. The baby has difficulty, but the first feed is very, very important and very nutritious actually. It provides lots of nutrition. That thick milk which is coming out, a special milk for the first few feeds, is called the colostrum. And after that, there is a free flow of the normal milk. Okay, so initially there is colostrum, but this colostrum is good for the baby. It's kind of a very thick milk, okay, full of proteins, full of antibodies, high amount of fat, and colostrum secretion. So in the last part of the pregnancy, when the baby is about to be delivered, colostrum is now filled inside the breast so that the baby can get first few feeds of the colostrum. Okay, all right. So hormonal system, I'm not talking about the hormones right now because we have a separate lecture for hormones acting on the breast, and then we'll talk about, okay, what at puberty, what during the other parts of the life, what happens during pregnancy. So non-pregnant, pregnant, we'll have a discussion separately. Okay, so we are avoiding it. All right, these are the Montgomery tubercles here around. Okay, the same thing. Okay, yeah, now we are coming to the systematic changes. Okay, the different changes one by one. Systematically we'll do the changes happening in the system. We are beginning with the cardiovascular system and we'll carry on with the other systems. Okay, the cardiovascular system of the mother. What is happening? Okay, well, heart of the mother. You know, now a new baby is growing in the uterus, and the baby is living and growing every day, and the demands of the baby are increasing. Demands means nutrition. Nutrition is supplied by the blood. Fetus has its own blood. Mother has its own blood. Mother's blood is passing through the uterus. Fetal blood is also موجود in the fetus inside the uterus. Placenta is the separation. Okay, so in the placenta both bloods are flowing. Okay, the mother's blood has to give nutrition. Fetus has no other source, you know that, isn't it? So it means mother has to take the responsibility of providing the nutrition, and this is coming from the blood. Do you think the mother will keep the same cardiac output and the same blood flow? Definitely not. Okay, it has to increase. So the maternal blood flow increases. For increasing the maternal blood flow, mother has to make the whole adjustment inside the cardiovascular system. Okay? If we are in the cardiovascular system, let us look at the heart. What happens in the heart? Can you ask him? Yeah. If you are not interested, can you leave the class, please? I'm not compelling you to sit in the class, come on. Okay, it's useless if you are watching and playing with a mobile and just staying in the class because of the attendance issue.